The teaching ward round buzzes with activity as the professor leads his team for the day. There will be a grand bedside discussion about Wilson's disease, also called hepatolenticular degeneration, which is an inherited disorder of copper metabolism caused by mutations in the ATP7B gene, which leads to copper accumulation, primarily affecting the liver and brain. Dr. Carter, the resident, stands ready, while Dr. Myers, the intern, looks a bit uneasy. Mr. Thompson, the patient, sits on the bed, his hands trembling.
Intern, tell me why this man was misdiagnosed for 2 years before reaching us.
His symptoms were non-specific: fatigue, mild liver enzyme elevations.
Non-specific? His tremors alone should have raised alarms. Dr. Carter, explain why this case was botched.
Classic pitfalls. His initial workup showed elevated AST and ALT, mistaken for viral hepatitis. His depression was treated with SSRIs, ignoring the wing-beating tremor and subtle dysarthria. No one checked ceruloplasmin or did a slit lamp exam.
I kept telling doctors something was wrong, but they said it was anxiety.
And now? His latest labs show ceruloplasmin 5 milligrams per deciliter, urinary copper 300 micrograms per 24 hours, and a liver biopsy with 450 micrograms per gram dry weight copper. Textbook Wilson's. Intern, what's the gene defect?
I think it's on chromosome 7.
Unbelievable. ATP7B on chromosome 13, with over 650 known mutations. Most common in Europeans is H1069Q. Dr. Carter, recite the Leipzig criteria for diagnosis.
Kaiser-Fleischer rings 2 points. Neurologic symptoms 2 points. Ceruloplasmin less than 22 points. Urinary copper over 100 micrograms 2 points. Genetic mutations 4 points if homozygous. Mr. Thompson scores 8 definite Wilsons. A total score of 4 or more confirms the diagnosis.
So, how much damage has been done?
Your MRI shows T2 hyperintensities in the basal ganglia. Copper is eating away at your brain, but we can stop it.
Mr. Thompson, describe your tremor.
It's like a fluttering in my chest, then my arms jerk. At work I spill coffee, they move me to desk duty.
Classic wing beating tremor, worse with posture. Intern, name the other movement disorders in Wilson's.
Parkinson's.
Wow, Parkinson's. Dr. Carter, list them with details.
Dystonia, 30 to 40% of cases. Twisting movements, facial grimacing. Parkinsonism, 20 to 30%. Rigidity, slow movements. Dysarthria, 70%. Slurred, spastic speech. And psychiatric symptoms, depression, even psychosis.
Last month, he thought our neighbors were spying on him. Is that the disease?
Yes, copper affects the brain's basal ganglia and frontal lobes, causing paranoia, mood swings, but treatment can reverse some symptoms.
I thought I was going crazy.
You're not. This is biology, not weakness. We'll fight it. Intern, first-line therapy?
I think it's penicillin, sir.
D-penicillamine. Derived from anti-leukocyte agents in the 1950s, Dr. Carter, explain the protocol before I retire out of despair.
Start at 250 milligrams per day, escalate to 1,000 milligrams. Must co-administer pyridoxine, vitamin B6, penicillamine depletes it. Monitor for nephrotoxicity, bone marrow suppression, and, critically, neurologic worsening in 20% of patients.
Worsening? How?
Sometimes mobilizing copper from tissues temporarily exacerbates symptoms. We'll watch closely.
Intern, what's our alternative if he can't tolerate it?
Triantine, sir.
A glimmer of hope. Yes, Triantine. And Dr. Carter, for maintenance, what's the drug of choice?
Zinc acetate, 50 milligrams 3 times daily, blocks gut copper absorption by inducing metallothionein, lifelong therapy.
Is it for lifelong?
Yes, if he stops the medicine, copper rebuilds. Fulminant liver failure, dementia, death. But if he takes his pills, he could live to see his grandkids.
The professor reaches for the slit lamp, his tone leaving no room for hesitation.
Time for the Kaiser-Fleischer rings. Intern, describe what we're looking for.
Green rings?
I weep for your patience. Dr. Carter?
Golden brown copper deposits in Decimet's membrane, starting as a superior crescent, then forming a full ring. Seen in 95% of neurologic Wilsons, but only 50% of hepatic presentations.
Look here, Mr. Thompson. See that golden halo around your iris? That's copper. Pathognomonic.
Can others see it?
Only with a slit lamp now, but if untreated, it becomes visible to the naked eye.
Oh God!
Good news? These rings fade with treatment. Now, intern, what's the face of the giant panda sign?
Zoo animal?
Why me? Dr. Carter, save us.
MRI finding. T2 hyperintensity in the midbrain resembling a panda's face, seen in advanced neurologic Wilson's.
The patient's wife sobs quietly and the room is heavy with the weight of the disease.
Will I ever work again?
If we treat aggressively, yes. But no more delaying pills, no alcohol, no high copper foods, liver, shellfish, chocolate, nuts. Your tremor may improve within 6 to 12 months. Depression often lifts faster. But adherence is everything.
What if it's too late?
His liver biopsy shows steatosis, not cirrhosis yet. His MRI has no cortical atrophy. We caught this just in time. This is a marathon, not a sprint. We'll be with you every step. Remember why we do this. One missed test, one lazy assumption, and lives unravel. Some of you need to rise to that responsibility.
The road ahead won't be easy, but now they see a path forward. For the first time in what feels like forever, they dare to believe in brighter days.